Hi everyone. My name is Nana Kweku Akon. I'm a perioperative nurse and you're welcome to my YouTube channel. Hi. You are welcome once again to NKA Surgical 101. And today we are going to do another classification of surgical instruments. Now we know the 10 classifications of surgical instruments: the cutting and dissecting, the probing and dilating, the exposing and retracting. Today, I want to talk about another classification of surgical instruments where surgical instruments are categorized or classified under two main streams. The first one is the general instrumentations. When we say general instrumentation, it means that in any particular surgery that you do, you need such basic or such general instruments for such a surgery. And then we also have another category called the special instruments. The special instruments are the special or particular instruments that are special to a particular case, that are added to the general instruments to handle a particular surgery. And those special instruments are the instruments that really differentiate one particular set from the other. So today we are going to be more specific about the general instruments. When we say general instrument, just like I already explained, they are the instruments that we need for every surgery. Every basic surgery or every surgery requires this basic instrument to operate. So talking about the basic set or the basic surgical instruments, the first instrument that I want to talk about is the Mayo's surgeon scissors, which is used to cut through tissues, and at the same time it is used to dissect tissues during surgery. The Mayo's surgeon scissors. The other instruments that you find in the basic set is the Mayo's stick scissors. The difference between the Mayo's stick scissors and the Mayo's surgeon scissors is the curvation. You see that the Mayo's surgeon scissors has a curve at the tip, and then the Mayo's stick scissors is straight. So that is the difference between the Mayo's surgeon scissors and then the Mayo's stick scissors. The Mayo's stick scissors or the assistant scissors is always used to cut sutures or stitch. And then the Mayo's surgeon scissors is used to cut and dissect through tissues. The second instrument that I want to talk about in the basic or the general instrument is the Bad Packer blade handles. The Bad Packer blade handles are the handles that we mount our surgical blades on, which is used in cutting tissues. There are various sizes of the Bad Packer blade handles. We have a size 3, we have a size 4, and we have a size 7 sometimes. And the sizes determine what kind of blade we mount on them. So the size 4 handle always take the blade sizes 20, 22, 24, and above. But the size 3 also takes the smaller blades, ranging from size 10 blade, size 11, up to size 15 blade. So when you are picking your Bad Packer handles, the size will tell you what kind of blade that you should mount on them. The other instrument in the basic or the general set is the dissecting forceps. And with the dissecting forceps, we have two types of dissecting forceps. We have the tooth and then we have the non-tooth forceps. The tooth forceps always have a tooth or a teeth at the tip of it that helps in grasping tissues. But with the non-tooth dissecting forceps, it has plain serrations that will also help in grasping tissues. So the tooth forceps is used to hold tough tissues. Example is the skin or the fascia. And then the non-tooth is used to hold soft tissues. Example, intestines, the uterus, and other soft tissues in the body. The other instrument in the basic set that you will always find are the mosquito artery forceps. Mosquito artery forceps. They are used to clamp and occlude vessels when they are bleeding. So another instrument that you may find in the general set or the basic surgical instrument is the Alice tissue forceps. The Alice tissue forceps is also used for holding tough tissues. Examples of tough tissue is the skin, the fascia. So during surgery, if you want to hold any of these tissues, all you need is your Alice tissue forceps. We also have the Osner corkers. They are also used for holding tough tissues. And the difference between the corker and the artery forceps is that the corker has a tooth at the end, but the artery forceps doesn't have any tooth at the end. The Ochsner corker is traumatic, the artery forceps is not. The Ochsner corker is used for holding tough tissues during surgery. The other instrument that you may find in the general instrument is the Mayer's needle holder, which is used for holding the needle for suturing during surgery. We also have our Rampley's sponge holding forceps that we mount our swabs on for cleaning the patient before we drape. We have retractors. This retractor is called the Army Navy retractor, and they are used for retracting during surgery. We also have other retractors like the Lagenbecks that you may find in the general instrument set. You may also find your gallipots and then your kidney disc in the general basic set during surgery. There's one particular instrument that you may also find in a basic or a general instrumentation set, which is called the backhouse towel clip, which is used for holding towels during draping. Some surgeons at some point may use it as a grasping and holding instrument during some cases like myomectomies and hysterectomies. Thank you everybody for watching NKA Surgical 101 on surgical instrumentations. If you want more, kindly hit the subscribe button and follow my channel for more updates on surgical instrumentations and stuff that are happening in theater. Thank you very much.